Dr. Payne Show, 1-855-55 Dr. Lou, DRLOU is the number to get a hold of anytime. How you doing, pal? Everything good?
Yourself? Yeah.
We got a guest today.
We do.
Wow. It's like 640 nepotism here. We got Savannah Tamarkin here from the Insurance and Injury Law Show, also on the weekends here on 640. You guys are going to hash it back and forth for a bit, but we always get the show started with the week that was, right?
Yeah, for sure. Yeah, Savannah and I will go back and forth on some interesting things. Obviously, with a lot of our listeners that are suffering with different injuries, they may have legal claims associated with those. So we thought it would be a good idea to bring them in and just get some advice on some of those issues. But yes, we do always start with kind of some clinical cases. An interesting one that I had this week that I wanted to go over. This was nothing where I actually, I would say the vast majority of my cases are people who are coming in and are not really sure what's wrong with them, right, and they're trying to figure it out, and they're looking for me and my team for that help. This person already knew what their problem was, but needed someone to help gauge it, so I'll take you through the problem. This person is 64 years old, male, and has a 5-year history of multiple sclerosis and also a 6-year history or 7-year history, I can't remember now, of diabetes. And his primary complaints are sensory issues. So obviously most people understand that multiple sclerosis tends to cause neurological deficits, but diabetes as well can lead to peripheral neuropathy, which can lead to different types of neurological conditions, specifically usually sensory loss in the hands and in the feet. So his problem, even on the MS side, when someone who has MS, some people may have more motor symptoms where they actually have problem moving limbs, etc., and other people may have more problems on the sensory side. So his problems are all on the sensory side. From a motor perspective, it's not that great, but also not very bad. And so his problem is compounded because he's got two things that potentially affect the peripheral nervous system, being the MS and the diabetes. And so the reason why he came in to see me was simply because he feels that he's not being managed and monitored the right way with his current team. He basically said to me, I go to my family doctor, and this family doctor is very, very dismissive of me and kind of just keeps telling me, it's part of, the stuff you got going on and it's related to your age, and just dismisses it. And then even with the neurological appointments that he has, they're just so far apart that he feels like he's getting worse quicker. He has a primary progressive form of MS, which does tend to progress quicker than something like the relapse remitting form. And so he was basically saying, I need somebody to help me gauge this. And so someone that can kind of look at me every few months. And this is essentially one of the things that I do with people who have issues. It's always very, very important to have baseline testing. Now, baseline meaning when I see this person, the reality of his baseline right now is also going to be determined by his overall condition. But, even with young athletes, we do a lot of baseline testing around concussion, because then that way we know what are we getting them back to, what was their starting level. So I see this person on this day, and I went through a full neurological exam with him to essentially outline where the deficits were from a neurological standpoint, and obviously making good detailed clinical notes so that we can follow up every 3-4 months, whatever it is, just to see if things progress, because you'll be able to pick a lot of that stuff up on physical exam. The MRIs are going to be important to look for more demyelinating lesions throughout the brain and the spinal cord, but it's also important to do those things, and I've always said this, do the things you see on an image correlate with what you're seeing in the patient? Because there's a lot of people out there with MS that have so many demyelinating lesions throughout their nervous system, but then their symptoms aren't that bad. And then there's other people who have really bad symptoms, but there's not that much demyelination. And that goes consistent with a lot of the things that we've talked about, where someone who has back pain but doesn't have degenerative disc disease, and versus other people who sometimes on x-ray have very, very severe degenerative disc disease, have no back pain. So you always need to correlate. So we went through a good neurological exam with him, made a detailed initial consult and notes outlining exactly where his deficits were. And that way now the plan is to monitor him going forward and see if from a symptomatic standpoint he worsens, and if those things are objectified in the clinical exam, specifically the neurological exam. And so I wanted to bring that up just so the people out there that do have issues, if you're having problems having them monitored, we can help you with that. Cool. Me and my team, we can absolutely help you with that. But another thing that was interesting in this case, and I guess this would be a good thing, maybe Savannah could chime in on this, was he said to me the majority of his problems are on the sensory side, as I mentioned, and it affects his balance. He can't. You could tell he's got a problem from the minute he walks into the office. And he said to me that he asked his family doctor a couple of months ago for an accessible parking permit, because he just says, I try to park far and get my exercise, but lately my balance has been off and just can't do it. And he went back to the doctor and to his family doctor and basically said, I'd like to have this accessible parking permit just, because I need it, essentially. This is a person who absolutely needs it. And his doctor basically said to him, well, the ministry comes down on us really hard, and we shouldn't really overprescribe these things to people because a lot of people don't need it. And so he dismissed them. And it's like, well, why does that matter? Fine, don't give it to people who don't need it. But this person absolutely needed it. No. And I right away printed out the form and filled it out for him, because it was just, I gave him a permanent one. Like, this is MS. He's not going to get better. This isn't an issue where, let's reevaluate in 12 months and maybe all of a sudden your balance is 100% better. No, this is primary progressive MS. This is a person who absolutely needs an accessible parking permit, and I just think it's absolutely horrendous that a family doctor out there would have denied this individual that.
We'll take a short break. 1-855-55 Dr. Lou, DRLOU is the number anytime. Get that free consultation happening. We'll talk about that as well after a short break, and info@paincarecanada.com through email as well. The Dr. Payne Show continues. Talk Radio, AM 640. 1-855-55 Dr. Lou, DRLOU is the number. info@paincarecanada.com. I just wanted to mention before we continue with Sivan here this morning, free consultation. We always talk about that, right? What is it?
Just simply give me a call, the 1-855-55 Dr. Lou number. You call, hit option 2. You're going to leave me a voicemail. Give me your name, your number, a quick history. You don't have to go into detail because I'm going to call you about what your issue is. I'm going to call you back within 24 to 48 hours, depending on how busy I am. And we could just simply go through what your concerns are. And if I think that this is something that me or someone in my team is able to assess and help manage, then I'll make that recommendation. Right. Sometimes people call and it's just a matter of, it sounds like you're on the right path, so continue down that path. Or, maybe you should go see your family doctor about this first. And obviously, if there's anything that's a medical emergency, you shouldn't be calling Dr. Lou. You should be calling 911. That's another thing. But going back to the case with the gentleman with the accessible parking, Sivan, is there, I'm sure you've maybe seen this as well with the people that you deal with, where doctors sometimes don't want to help out with these people's care, and for whatever reason they're afraid of the ministry or someone coming down on them because a certain medication is overprescribed. But I believe it's a disservice, obviously, to turn away people who actually need something. And in this person's case with the accessible parking, this person absolutely needed it. It was very relevant in my exam, and I gave it to him, and I'm not really sure why someone else wouldn't. Do you encounter this stuff?
We do. We absolutely do. And, I will tell you, as I'm listening to you, when I handle cases, whether they're car accidents, LTD claims, whatever it is that I'm handling from the legal side, there is a partnership that goes on between the lawyer, myself, my team, and the clinic and the doctors. And it's extremely frustrating sometimes having certain doctors not only not cooperating, but standing in the way.
Yeah. Just stonewall you.
Just stonewall. And it's and it's not as though this is something that they have to pay for themselves. Right. It's not something, you're asking them to help their patients, right? That's what the patients are asking for. And that's the difference between you and the way you handle the people you deal with and a lot of the doctors out there. So kudos to you. That's the difference between somebody who wants to help an individual and someone who just goes about their day, just going through the motions.
Yeah.
So there's nothing legally that you can do except for advocate for yourself.
Right. And the other thing is I've met doctors who sometimes are apprehensive to fill out long forms that could take a very long time. For anyone who's ever seen an accessible parking permit application, the first page is completely filled out by the person themselves, their name, their phone number, their address, those relevant things. And the second page for the doctor is literally 2 check marks in different areas and your signature and your stamp. Like it's not something that you could say, oh, well, I can't get to this right now. Yeah, because it's literally something that you can do in that moment in front of the patient. And again, I don't think this should be abused and people that don't need it, because that's another problem for sure. But this is another issue with the whole opioid crisis, and obviously being in pain management and the physicians that I work with, this is a big issue because they're coming down on let's get rid of using opioids. But some people, that's all that really works for them at this point. And it's kind of the idea that, yes, we should be using the opioids where opioids are needed, but not necessarily saying no one should ever use opioids again, because that just doesn't make sense. You are literally taking something away from someone who's been able to, something from someone that's been able to help manage their pain. And I have so many patients that come in and say, I can't get the medication that I need, and I was fine. I'm not an addict. I'm a functioning human being. I just use this because it helps me to manage my pain. And now all of a sudden I'm being told that I can't have this. And it's completely wrong for people to, and practitioners to, generalize on a patient basis, based on everything else that's going on. It should be relevant to that patient for sure.
1-855-55-Dr. Lou, DRLOU, and info@paincarecanada.com. Since we have Sivan here for the morning, let's talk a little bit about injuries, result of car accidents and slip and falls.
For
right?
sure.
It's getting that time of year.
Yeah, it's that time of the year. And definitely always spine-related complaints tend to usually be involved in most types of car accidents or slips and falls. And then you get into sprain strains of other areas. Then, depending on the severity of these things, you can get into fractures and tears in muscles. Obviously, a big component around motor vehicle accidents and even slips and falls for that case is some type of trauma to the brain, something that could be as serious maybe as a hemorrhage, or maybe something like a coma, or sorry, not concussion, a concussion that is not necessarily as objective, obviously, as a brain hemorrhage or something like that. But all of these things are going to affect people, and we see a whole host of people who suffer from car accidents and slip and falls, and they come to us for the care. And one of the things that, that I struggle with sometimes is I mention to these people, hey, because they'll present to us usually first, especially if it's nothing that's very, very severe. They're just looking for some help. And I will usually recommend to them, hey, you need to get a lawyer involved here. And for whatever reason, I'm not really sure, but sometimes people feel like, oh, no, I don't want to do that. It's bad karma. I've heard
the
this
L word. You're scared of it.
Yeah, it's like, no, that's bad karma. I don't want to sue anybody and like all of these things. It's like, yeah, but this is your right. Why wouldn't you want to get this? And not only that, but what if you don't recover well? What if this creates a long-lasting problem? What do you do? So I think when we come back from the break, I really want Sivan to really touch upon this and the importance of why a lawyer on your side, while after a car accident or a disability claim or a slip and fall, why that's so extremely important. Because I advocate it to my patients, and again, for whatever reason, and I'm sure there's a lot of people listening right now, they just feel like they don't want to. They don't want to go that route, and they don't really understand how that can maybe block them in the future. So we'll touch on that when we get back.
1-855-55-Dr. Lou, DRLOU, and info@paincarecanada.com. Get that free consultation happening. Contact Dr. Lou. Lots more of the Dr. Payne Show. Short break coming up right here. Talk Radio, AM 640. 1-855-55-Dr. Lou, DRLOU, info@paincarecanada.com if you want some more information via email. Sivan Tamarkin here from the Insurance and Injury Law Show, also on 640. A lot of confluence between you two, one being an insurance lawyer, injury lawyer, and you running a clinic. I mean, you guys are always chatting back and forth, right?
For sure, yeah. And so, again, we thought it would be a very good idea. We've been on each other's shows, and, Sivan's audience sometimes needs to hear the healthcare side, but equally the audience that listens to me sometimes needs to hear the legal side of things. And before we went to break, I was mentioning that a lot of times with patients that I have that have been involved in different types of car accidents, slip and falls, and I recommend getting legal counsel, there's an apprehension, and I'm not really sure why. And a lot of the times, for whatever reason, I hear that that's bad karma, or I don't really want to go down that road. And can you just go into why it's so very important to have that legal counsel on your side?
Absolutely. So first of all, you're right. It's extremely common. I mean, first and foremost, you should be focusing on trying to get better. That's why they come to you, and that makes sense. That's natural. The risk of not calling us or not emailing us or not contacting a lawyer in general is that you don't know what your legal rights are. Remember, if somebody caused an accident and as a result of that you were injured, by law you are entitled to compensation.
Right.
Okay, so it's not you trying to squeeze the system or trying to get money that's not rightfully yours. It's no different than if you were to be let go from your job. You're entitled to severance. It's the same principle. Now, the risk of not getting legal advice, not necessarily hiring a lawyer, but not getting legal advice as soon as possible, is that you may miss a limitation period. right? You may not be able to recover after a certain period of time, whether it's a disability claim, car accident claim, slip and fall, whatever it is. So just getting the information, which by the way is free, and I'm not talking about consulting Dr. Google, right, which everyone does. The law is very fluid. It changes all the time. It's extremely important to get the necessary legal advice. And by the way, many people who contact us are not the individuals who actually suffered the injury. It's the family, it's the friends, people who are concerned, right? So don't bury your head in the sand. It's no different than not seeking medical advice, right? I mean, it's not going to go away.
Right.
You have to deal with it. You have to take care of it. So knowledge is power.
Right. And, one of the other things that I totally agree with that. And sometimes I've had people who in the beginning say, no, I don't want to get my legal advice. I don't want to get a lawyer involved. Then all of a sudden, the reality of what I told them could happen, which is maybe you don't get better because you also have another comorbidity or whatever reason. There's a whole multitude of reasons why someone maybe doesn't get better. And then all of a sudden, the insurance company comes back and says, hey, that's it. You're done treatment. And the patients turn to me and say, well, I still need treatment. I don't feel any better. And it's like, well, that's why I mentioned get a lawyer in the beginning, because there's only so much that I can do. My scope is as a healthcare professional is to provide advice. I'm not there to fight insurance companies. Is it ever too late for them to, if they get to that point, can they still contact you at that point? Or is there that limitation that you were just speaking about?
They should always contact me as soon as possible.
Right.
But if you're one of those people who waited, right, and now the funds ran out or they cut you off, which, by the way, insurance companies do all the time, still come and speak with us because maybe you're not beyond the limitation period. Maybe we can do something. The key thing is not to make the mistakes along the way. That's the reason why we want to give you that advice for free, by the way. But, if you're in that situation and, you don't know what to do, contact us because maybe, first of all, you're not out of time. And secondly, even if you are, sometimes there are exceptions.
Right.
Exceptions in the law that we can utilize to get you back on track.
Right. Yeah, and I think Sivan highlights a very important point that in the beginning, even if you're apprehensive, it costs you nothing to call someone like Sivan and just get that advice. Just, and the other thing is here, from my perspective, from a healthcare professional, I've dealt with a lot of personal injury firms out there. There's the same as there's good and bad clinics, there's good and bad firms. That is 100%. And the reason why I bring someone like Sivan and his team here is because I can trust that they're the right people. If you need to talk to somebody, it's early in whatever's happened, just call them. Just have a conversation. There's nothing, like you said, Sivan, they don't have to sign on with you. They can just get their advice. If they like what they hear, they can go. If they choose not to, but you lose nothing in that first phone call just to get your rights.
Absolutely. There's no contract that's put in front of you. There's nothing. Oftentimes it's a phone call. It's an email. I got a ton of email. Even this morning I was getting emails and I respond within minutes.
Yeah.
For me, I don't have to diagnose you, the way that you have to do so. For me, I'm just asking for a few key pieces of information, and then I can tell you what your legal rights are. And that's it. And at that point, you can make a decision how you want to proceed. Do you want to get more information? It's really up to you. But at that point, you have the power to make the decision on how to go about your compensation.
Well, I think a lot of people, too, they don't realize we would, everybody in this room, but a lot of the times that people will contact you and they assume right away, they're going to sign you up. How many people call you and say, you don't need me, you're good, you don't need me?
Yeah, in fact, I had one this morning,
right.
That was asking about disability tax credits. I had a lawyer, blah, 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 and I said, I emailed back and I said, you don't need a lawyer. Don't pay a lawyer for this. If you don't need this, then I'm going to tell you don't need this. If you have no rights, I'm going to tell you have no rights. But oftentimes they contact me when it's too late. Exactly what you said.
And that same point goes with me as well for people who are listening. But it's very similar. Just call me, get the advice. There's a lot of the time, a high percentage, I'm not sure, but I just tell people you don't need anything else. You're doing I had a person that called me the other day with some injury that she sustained, and she's being referred to a neurologist, orthopedic surgeon, and is not sure. And I said, hey,
you're covered.
You're on the right track. Whatever it is, you're on the right track. There's nothing else that can be added to this. So, and again, I think that when Sivan says that, when I say that, I think that's very important, that you deal with a professional who's not just looking to close a deal, but just really looking to give the right advice to people.
More coming up, 1-855-55 Lou, DRLOU. That is the number. The email is info@paincarecanada.com. It's the Dr. Pain Show, Talk Radio, AM 640. 1-855-55 Dr. Lou, DRLOU. Savannah Markin from the Insurance and Injury Law Show is here this morning as well, spreading the knowledge. Good to have you guys on. You guys together should just do a show together all the time because there's so much cross-pollination here. You can talk about it for hours,
maybe that's a good idea, John.
We'll cut you out and then we'll do it together.
We don't really need John at this point anymore then.
I don't know. Put that to a vote.
I think at this point he knows as much as we do.
He's
we need Leorn here for employment law too. Then we've got it covered, right?
He's the jack of all trades.
That's
here,
it.
For sure.
That's it. So car accidents again, big thing between the two of you,
for
right?
sure. One of the things again that I really want to bring up, and it actually saddens me to have to bring up this type of stuff, but I do want people to be aware of this stuff. And I'll preface it again by saying there's good and there's bad in every single profession, in every single type of business. A very sad thing that I've seen in my years around people going for therapy with regards to their car accidents, things like that, is that sometimes there's these side deals made that, don't worry, it's all about the money instead of actually getting better. And so it becomes a thing of, just come into the clinic, sign this, say that you were here today, and, we're going to say that you were here 3 times this week and 3 times next week, but you're never actually really there getting the treatment. And all you're trying to do is really build a claim. And now this goes beyond just number one being wrong because you're not going to get better in that instance. If you're not actually following through with treatment, I'm not really sure how someone can expect to get better. You also are now bordering on fraud, right? Like not just you, the person, but the clinic that's involved, the professional, potentially the lawyer, if they know about this. And I'm sure, Savannah, there's not only are there clinics that encourage this, there's also lawyers that encourage this. I've had certain people call me and say this is how we can do deals and this is how much money we give back to the person because they're valued this much. And it's like, I'm not really sure why this even happens. It all becomes a way of just scamming the system for, the mighty dollar. But at the end of the day, these are people that have been hurt in car accidents and they need to get better. And all you're doing is making them a paycheck for the clinic, for the lawyer, and potentially, for themselves too. But I'm not really sure why professionals get involved in this type of stuff. And Savannah, I just wanted your take on, from my perspective, I do think it's prevalent. I've heard of a lot of people. In fact, we have sometimes people who walk into some of our clinics who just flat out ask us, say, hey, I was in a car accident. If I come here, will we be splitting the money of the accident? I've had practitioners tell me that happens. And it's like, no, you can come here. We can get you the care that you deserve. But we're not going to be doing any of that stuff. So do you see this as well, Savannah?
Yes, I do. And I can tell you, or for the listeners out there, that what you see in Hollywood, in the movies, many of those things actually happen. With insurance companies, with clinics, with lawyers. It's a very shady business, which is why, as lawyers, personal injury lawyers, we get a bad rap because of a few bad apples. But I can tell you this. I remember I used to be a defense lawyer. I used to work for insurance companies. Insurance companies know. They know which clinics are quote-unquote bad, which ones are on their naughty list, okay, and which ones are legit. And, believe it or not, Luigi, I had clinics contact me. In fact, that happens, I would say, about 4 or 5 times a year, contacting me saying, I'm on that bad list. The insurance company's not paying anything. What can I do? And, my response is, I can't do anything for you because there's usually a reason. Yeah. Now, from a legal perspective, if you go to these clinics and get treatments, even if you have a legitimate claim, right? Even if you are legitimately injured, by virtue of going to those clinics and then filing a legal claim, you are now associated with those clinics. So the insurance companies are going to be very skeptical of your injuries, of your credibility. So you have to be extremely careful which clinics you are going to. And again, that goes to, the whole area of trust, and that goes to the whole area of getting the best care possible. Stay away from all those tainted places.
For sure. And, a big thing I think is if you get that gut instinct, if you go to a clinic or you go to speak to a personal injury lawyer after an accident, you have a gut instinct that just doesn't
your
feel
spidey
well.
sense says this ain't on the up and up.
I've had some of my patients who are good patients who, for whatever reason, went to maybe a lawyer that they had heard of from a friend, and then they'll come back and they'll say to me, I was hurt in a car accident, my low back hurts, nothing major, small type of injury. I assess it. I determine, this is nothing major. But meanwhile, they're dealing with this lawyer, and then they're coming back sometimes, and they're saying, the lawyer's telling me that, I should say that I have nightmares and all this stuff because they want to create a psychological issue, which obviously Savannah can touch on this more. It's very easy to objectify if something is fractured. You take an X-ray. If there's a fracture, there's a fracture. However, once you start bordering on the the psychosocial issues around pain management, that's much, much harder to objectify, and it's very subjective to the person. And I have people coming in saying, my lawyer's been telling me that I should be saying that I can't work, but I don't want to go off of work, and all of these things. And it's like, hey, that's the wrong type of lawyer to have. And this is exactly why, again, I want to bring someone like Savan onto the show, because this is a person that I would trust, that if you're listening to me, you've been hurt in an accident, you need a lawyer, you should be going to Savan and his team, because I'm going to assume, I can guarantee that you won't be telling them
Better call
things.
Saul.
Yeah. Better call Saul, exactly. No, 100%. And again, the same thing goes with clinics, the same thing. I mean, if I tell somebody to go to you, to see you, it's because I trust that you're going to take care of them. I mean, it's my word. It's my reputation that's on the line. And, within the legal communities, lawyers have a reputation as well. Right. Very, very important. And so the insurance lawyers know that when we represent someone, it's because there's a legitimate claim out there. Right. And you're right. I've had people come to me who have lawyers, and those lawyers are telling them to do certain things which are plainly illegal.
Yeah.
You cannot lie. Right? You can't. Aside from the moral and ethical aspects,
right.
you should not lie. You're gonna get caught, and I'm telling you that as someone who worked for insurance companies. You will get caught. Don't even go there. And if the lawyer's telling you to lie, very, very bad sign.
1-855-55 Dr. Lou, DRLOU, info@paincarecanada.com. More Dr. Payne Show coming up. Talk Radio, AM 640. 1-855-55 Dr. Lou, DRLOU, info@paincarecanada.com for contact. Savan Tamarkin from the Insurance and Injury Law Show joining the show today, because there's a lot of stuff that both you guys deal with at the same time, right? We'll talk a little more about that, getting into clinics and possibly, making up stuff, whether it's the patient's, objective or not. Sometimes that happens, right?
Yeah, for sure. And this could be, I also run a medical assessment business where we provide independent evaluations to both lawyers, insurance companies, when it's required in these types of accidents where there's a third-party payer involved. And one of the things that I can tell you is sometimes you'll be working with someone, and it may very well be the clinic, it might be the lawyer, it could be everybody on that same page, or you, the person, think that you can somehow go into an assessment and be smarter than the assessor and fake something. And so, you've maybe been coached a little bit on, you got to really present like this is a disc herniation, and here's what I want you to do. The one thing that I can tell you is you would have to have the equivalent amount of knowledge and clinical experience as that person assessing you in order to actually be able to trick them. Like, let's be honest here. These are people, these are physicians, doctors, chiropractors, whoever, people that have gone to school, studied this stuff for 8, 10, 12, some specialties, 14 years. You are not going to be able to hear something for 5 minutes or read something on Wikipedia or
a couple notes scratched on a napkin
and think that you're going to be able to fool these people. It just does not happen. And in fact, you're better off going there with the extent of your injury, whatever it is, and that's going to bode better for you than if you go there and you try to fake it. We look for things that are called inorganic signs. So we can tell if someone is doing something that doesn't really make sense, that, physiology and anatomy and neurology, whatever it may be, don't really present that way. It doesn't present that way, and we know that. The other thing that's very important is there's something that these people forget. They think that they're only being assessed during the point when they're in the room. There's something called casual observation. And casual observation means if I go call my patient in the waiting room and they're sitting down, and, I see them get up and I get them and they walk over to me properly, but then we get in the room and I say, okay, I'm going to assess your gait. I need you to walk back and forth to the wall. And all of a sudden that gait pattern changed. Well, come on. What really happened? Like, nice. You can pick this stuff up. It's like, sometimes I'll even do things where you can see someone sitting in a chair, they're absolutely fine. And then you get them, maybe a low back complaint, you get them in the office and you say, okay, I need you to bend down and touch your toes. Well, I can't do that. Well, what do you mean you can't do that? You were just in a flex position, sitting down. At least show me that you can try. And so you can right away tell the difference between a person who is trying to amplify whatever it is. These people may very well have pain and may very well have a limitation. They're just trying maybe to amplify it and make it seem greater because they think that that will be better for them in their claim. And I can just tell you from the healthcare perspective, you're not fooling anyone. And I'm sure Savan can touch on that, the fact that from a legal perspective, you're probably doing something very, very wrong that's probably not going to help your case.
No, it's not going to help your case at all. And again, it all comes down to credibility.
Yeah.
I mean, it's not difficult to figure out if somebody is not being credible. And from a legal standpoint, when we look at reports, doctors' reports, clinic reports, we are looking for validity testing. Mm-hmm. We're looking to see what the assessment is of the validity of the test results. And, again, you can be shooting yourself in the foot. And you're going to have lawyers out there who are going to tell you to fake certain things. You have to be careful. It's going to torpedo your case, which means you're not going to get the money that is owed to you by law at the end of the day because you lied.
Right. Yeah. And I think for sure, this is so important that if you're listening, and I see this all the time, don't exaggerate your injuries. Just be the person that you are. That's going to be, I've seen people who, from a functional perspective, when I've assessed them, there may not be necessarily anything wrong from a functional perspective. And again, we started this by saying that functional things are much easier to objectify, because if someone can only bend 25%, I could put a number to that. But when someone says, hey, I have pain, but full function, that doesn't necessarily mean that your case is garbage. You can still have full function and yet have extreme levels of pain. That's just the reality of the way pain works. And any good physician, any good assessor knows this, and they'll divulge into other things that you can start to see patterns, right? People who have depression tend to have higher pain levels. Poor sleep tend to have higher pain levels. All these things can, be assessed during that assessment. And you're not going to be able to fool whoever this assessor is, and just lying about these things is just simply wrong. And it's also, from another perspective, sometimes when you lie too much, you start to believe your lie.
Sure.
You actually create pain for yourself, right? That's the whole psychosocial component of it, that if you say something so many times, you think about something so many times. I've seen people who have spiraled out of control because they've, convinced themselves that what they have is worse than what they have. And it can be very, very bad, and it can get disastrous.
1-855-55 Lou, DRLOU, anytime. Get that free consultation happening. Email contact as well, info@paincarecanada.com. Dr. Pain Show, Talk Radio, AM 640. 1-855-55 Lou, DRLOU, and info@paincarecanada.com. For both you and Sivan here this morning, you talked about it at length this morning. Make sure you do your due diligence and work with a good, reputable legal team and a clinic as well. So now anybody listening, or some people listening, are going to say, okay, how do I find that person?
How do you find that? Yeah, right. For sure. I mean, you could start by calling either myself or
for
Sivan,
sure.
But I like the question, and for sure, I'll speak on the clinic side, and then we'll let Sivan speak on the legal side. The one thing that I can tell you is, if you're going to a clinic and you're telling them that you were just involved in a car accident and you have some injuries, number one, they should not be worried about the car accident as much as they're worried about the injuries, okay? So first and foremost, are they properly assessing you, right? If they start talking about, there's $3,500 of care and you're going to start doing massage and you're going to do this, it's like, well, hang on a sec. How do you know what they need with that $3,500 of care if you haven't even assessed them yet? So that, for me, if someone comes into me and says, hey, I've gone in a car accident, what do I say? I say, well, we got to start with an assessment. Let's figure out what's wrong. If there's something wrong, we're going to treat it the right way. We're not just going to treat it with whatever's in these four walls, because again, if in these four walls is only a physiotherapist, for example, but the majority of the problem that I see is you're maybe experiencing post-traumatic stress, well, then I think a referral to a psychologist or a social worker is much more warranted, and maybe the majority of that initial chunk of money should be going there. So I think that's a big thing. If you're going in somewhere and they're right away talking about, here's what you have to do, and they haven't even assessed you, that to me is a red flag. It's like, well, no, assess the person first, figure out what the injuries are, what the diagnosis is, and then make the recommendation for treatment based on what that diagnosis is. It shouldn't be about whatever their benefit is, the value of their benefit, how much treatment they can get within that, because you shouldn't know that without knowing what the problem is first. So that, for me, right off the bat, is a big red flag. Obviously, if you go somewhere and someone says, oh, we split money with you, or this, or anything that sounds shady, if your spidey senses are going off, I think those are all red flags, and those are not the people you should be dealing with. You should be going somewhere where their first concern from a healthcare professional standpoint is just simply your care and your health. And if you feel that person is most concerned about your health, I think you're in the right place.
They're kind of cookie cuttering everybody.
You're right.
It's wrong.
And then once you've gotten into, after the assessment's done and they say, okay, based on the eligible amount that's available here, I think this is what you need, and I think we should also refer you to this person, and blah blah blah. Those are all good signs, and most people have that gut instinct. And so I'll let Sivan touch on what are the red flags for if you're contacting a lawyer.
Yeah, and it's very similar to what you're talking about, which is that when people come to me, again, if Well, not just to me. If you're contacting a lawyer, first of all, do your due diligence. Okay, read up about that person, their experience, reviews, anything you can get your hands on. Okay, very, very important. If you go and speak with that lawyer, or you talk to them by phone, email, whatever, and you get a sense that all they care about is just putting that contract, that retainer agreement in front of you, or telling you to pay anything up front, by the way, which
that's a big one, right?
Also should not happen in these kinds of cases, very few exceptions. Those are red signs. The lawyer should be asking you questions in a way similar to what Dr. Payne, to what Luigi has asked, which is, who have you seen? Have there been any assessments? Understand more about your particular situation, your family situation, your financial situation, because without all of these variables, we can't give you proper advice.
Right.
If all the lawyer cares about is signing you up, the way, when you contact a real estate agent and they come to your house and they don't even look at the house, they just, put a contract in front of you, you don't sign up with that person. Yeah. It's a major red flag. You have to feel that they actually take the time and ask you questions, assess your case properly, and then give you the advice, and then give you the option of how to proceed, right. Not tell you this is what you need to do. Yeah. Because they're not in your shoes. Yep. Very, very important to understand that. They're not in your shoes. They should not be pressuring you to do anything.
And I guess on your side, it's, right away, I'll get you $1 million for that injury, no problem. And on your side, it might be like, we'll fix it. You'll be paying free when you're done with it. You can't make those promises.
No, you can't make that. You have to be honest with people and give them what the research would suggest for their injuries. Another thing that I think relates to both of us here on the red flag issue is there's been people who have come to me, a car accident, and then I'll say to them, I believe you should contact Savan. And they may turn to me and say, no, you know what? I have another personal injury lawyer that I've dealt with before, and they're great. I love them. My answer to that is no problem. I hear people who say, well, I've had patients who have come back to me and said, I was going to some other clinic because when I called this lawyer after my car accident, they said, I have to go to this clinic.
Wow.
Have to go. You should never have to go anywhere. If you want to use the clinic that you're using and another personal injury lawyer, you are allowed to do whatever you want. No clinic can tell you have to use this lawyer, and no lawyer can tell you have to use this clinic. And that to me is another red flag. And I'm sure you see that, Savan.
I see it all the time, and you're absolutely right. And I'll tell you, think about it this way. If the lawyer is insisting that you go to the clinic they're sending you, why?
Exactly.
Why? What are they getting out of it? Yeah. They're not just telling you this for their health.
Yeah, where's the conflict?
It's a red 100%. I agree with you. And I've seen that countless times.
And the thing is, they'll trick people into this where they don't, the average person may not realize the conflict of interest. They don't realize the way this industry works. And they just say like, well, I was told that I had to, that it's the way that the insurance world works. I don't have a choice. And it's like, no. You always have a choice. In fact, and lawyers aren't even guilty of that. Sometimes the insurers are guilty of that, where they say, here, go to this clinic. No, you are allowed to go to whatever clinic you feel most comfortable in. And so that you can make a recommendation. Anybody can make a recommendation. The same I can recommend Savan, but I ain't forcing anybody. In the same way, Savan's not going to force you to come see me. He may suggest it, but even an insurance company, they're just as guilty of this. And not the insurer that like as a group, but maybe the adjuster who says, no, go to this clinic. You don't know what kind of side deals exist and the things that people do. You have the right. You are the person in charge. You go wherever you like. Maybe if you want to take the advice because you feel your care might be better, your overall claim might be better if your work, that's your choice. But just know that you have a choice.
Good for another week, guys. Thank you, Savan, for coming out to the show today. The Insurance Injury Law Show, also here on Talk Radio AM 640. Till next time, you want to get a hold of Dr. Payne and his team. It is 1-855-55-DR-LOU, DRLOU. Email is info@paynecarecanada.com.